Hello everyone. In this video, we'll be learning about homeopathic remedies and their indications in hemorrhage. In the previous two videos, we read about arnica and hemimyllis in the first lecture, and the second video we learned about calcarea carbon camphora. In this video, we'll learn about phosphorus and ipecac. First, I'll be dealing with phosphorus, then with ipecac. Phosphorus has a hemorrhagic diathesis, which means the people are prone to bleeding. The diathesis is a condition which makes people susceptible to the diseases. That is, these people have hemorrhagic diathesis. The wounds bleed very much, even if very small. Wounds that may appear to have healed break open again. Here, the wounds will bleed very much. There will be profuse bleeding, and the wounds which will seem like they are healed, they will break open again. In phosphorus, the character of the blood is bright red, watery and non-coagulable, intermittent flow, ecchymosis with purpuric spots. This purpuric spots, ecchymosis, they are small hemorrhagic spots, red bloody spots which are present in the skin. Acute hemorrhage rather than chronic calls for this remedy. In acute hemorrhages, recent injuries, acute hemorrhages, then phosphorus is indicated rather than the chronic conditions. Vicarious menstruation, epistaxis instead of menses, which means vicarious menstruation is bleeding from the other orifices of the body rather than from the uterus. So here the bleeding is in the nose, that is epistaxis. Same occurs in bryonia. Cough, left side of the chest is usually affected. Sputa is rusty, blood colored or purulent. In cough, left side of chest will be affected, and the sputum will contain blood and it is purulent, which means there is pus. Aggravation of the cough is lying on the left side and from cold air. Amelioration of the cough is by lying on the right side. Whenever the patient is sleeping on to his left side, the cough will increase. When he switches to the right side, the cough will decrease. Stomach, great burning in the stomach. Sometimes there may be vomiting of bright red blood. Hemorrhage. Phosphorus is a great anti-hemorrhagic remedy. Hemorrhage is caused by degeneration of tissue and occurs from small injuries or cuts. So, there is bleeding whenever there is a small injury and there is a destruction of a tissue. Bleeding from various organs and parts of the body. Small wounds will bleed very much, pours out freely and then ceases suddenly for a time. Here, bleeding will be too much, it will be profuse, then it suddenly ceases. The bleeding, it moves freely and then suddenly it stops. Seen in metorrhagia, hemoptysis, hematemesis from nose, stomach, anus, etc. Hemoptysis is nothing but the blood in the sputum. Hematemesis means the vomit which contains blood. Temperament, sanguine temperament, thermals, chilly patient. Phosphorus is a chilly patient. Ailments, loss of vital fluids, mental exertion, sprain, wounds, lifting, etc. Modalities, aggravation is from lying on the left side and painful side. Change of weather during a thunderstorm. Amelioration by lying on the right side, cold water, cold food and in darkness. Let's summarize. First, hemorrhagic diathesis, small wounds will bleed. They bleed profusely, then ceases suddenly, bright red blood. Then in ecchymosis, purpuric spots, and acute hemorrhages we give phosphorus, and in phosphorus vicarious menstruation is seen, epistaxis rather than the menses. In the cough, left side will be affected. The sputa contains blood and pus, and aggravated on left side, ameliorated on right side. Stomach, there will be burning in the stomach and vomit contains blood. Hemorrhage, as I told, small injuries, there will be degeneration and there will be hemorrhage. As well, the blood, it pours out freely, then ceases. It occurs in metorrhagia, hemoptysis, hematemesis, nose, stomach, anus, everything. Temperament, sanguine temperament, thermal chilly patient. Aggravated left side, ameliorated right side, and then amelioration from cold water, cold food, and in darkness. Ailments will be loss of vital fluids, mental exertion, sprains, wounds, and lifting. With this, we come to an end of phosphorus. Hope everything is clear. Now we'll be heading to ipecac. Sphere of action of ipecac will be arterial vascular system, medulla oblongata, gastrointestinal tract. Thermals, chilly patient. Phosphorus, chilly patient. Ipecac, chilly patient. Ailments, undigestible food. That is, people who eat chalk, mud, all such cravings for indigestible food, anger, reserved displeasure, injuries. Bright red hemorrhage from natural orifices like nostrils, mouth, especially from the uterus. Here also, like phosphorus, the character of the blood will be bright red. It also occurs from the nose, mouth, and more especially from the uterus. Ipecac is a great hemorrhagic remedy, active or passive hemorrhage. Character of the blood is profuse and steady flow of bright red blood. In the phosphorus, there was sudden flow, profuse flow, then it suddenly ceased. Here, it will be steady flow. There is no ceasing of the blood. Profuse, and there is a steady flow of bright red blood. Concomitants, nausea, oppressed breathing, thirstlessness, and a clean tongue. Ipecac people, whenever they are having hemorrhage, along with this, there will be nausea, oppressed breathing, thirstlessness, and a clean tongue. Whooping cough. Child loses breath, turns pale and blue in face. Gagging and vomiting of mucus. The cough is so severe that there is vomiting of the mucus. Bleeding from nose and mouth. Bones. Bones of the skull feel bruised, pain as if bones were all torn to pieces. In ipecac, the skull will feel bruised as if you have undergone a big injury, and the bones will be feeling as if they are torn into pieces. Female reproductive system. Hemorrhage, active or passive, bright red from the uterus. Profuse, clotted, heavy, oppressed breathing during menses, and stitches from navel to uterus. So, as we read, as a concomitant, there will be oppressed breathing during menses, stitches from the navel to the uterus. Stool, fecal covered with bloody mucus, bloody foul smelling. How are the stools in ipecac? They are covered with the bloody mucus and they are foul smelling. Hemoptysis after every exertion. Menses, they are too early, too profuse. Uterine hemorrhage of bright red clotted blood. Then urine, dark red, scanty, bloody, with cutting in abdomen and urethra. So urine characteristic, it is scanty and dark red. Everywhere it was bright red hemorrhage. In the urine of ipecac, dark red and scanty with a cutting in abdomen and urethra. The modalities of ipecac will be dry weather, warm, and slight motion. Ameliorated by lying down. Let's summarize. Ipecac, thermals, chilly patient. It acts on vascular system, medulla oblongata, and GIT. Ailments, undigestible food, anger, reserved displeasure, and injuries. Hemorrhages will be from the natural orifices, nose, mouth, and uterus. It is a hemorrhagic remedy, active as well as passive bleeding will be found. The bleeding will be profuse and steady flow will be there. Along with the bleeding, there will be nausea, oppressed breathing, clean tongue, thirstlessness. Whooping cough will be present in the children. There will be vomiting of mucus and bleeding from the nose and the mouth. In the bones, how will the bones feel? It's specially indicated in the skull, as if the skull is bruised and it was torn into pieces. Reproductive system, menses, there will be scanty menses, and urine will be scanty. Reproductive system, the menses will be heavy, they'll be bright red, they are profuse. Menses are profuse, urine is scanty. Stool will be covered with bloody mucus. Hemoptysis and menses is early and profuse. Urine hemorrhages of bright red and clotted blood. Uterine hemorrhage will be bright red and clotted blood will be there. And urine is scanty and dark red. Aggravation, dry weather, warmth and slight motion. Amelioration is by lying down. With this we come to an end of ipecac. I hope everything is clear. And then next video we'll be learning about lachesis and crotalis.